Hi there, everybody. This is Lee talking about single payer healthcare, Medicare for all. And so is Ralph Nader. He has sent a letter to Nancy Pelosi basically telling her to get off of it. She's House Minority Leader, and she claims that she supports the single payer healthcare option where everyone is covered, everyone is in, no one is out. And she's talked a big game, but she has done nothing to actually drum up support for John Conyers' bill. She's done nothing to co-sponsor his bill when he introduced it previously. She's done nothing to lobby other members of Congress to support that bill. And so she's talking loud and saying a lot, but doing nothing. And so the question becomes, why are you even there? Why are you the House Minority Leader? And so people need their health care. The House and the Senate, they have health care. We, the taxpayer, pay for their health care. They're fine. And maybe that's the lack of urgency that we're seeing. As long as they're covered, they don't really care whether we, the taxpayer, who covers them, whether we have health care. But we've seen that Medicare for all, it works. We've seen it in action. We've seen it in other countries as close as Canada, their universal health care system. Federal employees of the United States have Medicare for all. They are fully covered with universal health care. We, the taxpayers, do that for them. And that includes the House and the Senate, the Congress. And then we've also seen Medicare for people 65 and older. The benefits of that program for them, the lack of fear, the fact that people can actually afford to be ill and get cured without being thrown out of their homes. And then also, we've seen Medicare for All in Libby, Montana. That was a special case included in Obamacare because of the asbestos poisoning of that region. Max Baucus campaigned and lobbied for Medicare for all, no age mandate in Libby. And so we've seen these pilot programs on a limited basis of how Medicare for all, what it looks like, the benefits of it. Let's see. Let's see. Everyone's in, no one's out. There's a free choice of a doctor and hospital. There's no medical bankruptcies, no co-pays or deductibles, no fear or anxiety, and then no more deaths due to lack of health insurance or people just losing their homes, losing everything if they have a chronic illness. And so rather than actually focus their attention on single payer, the Medicare for all option, quite a few of the Democrats have come up with a very weak defense, which is indefensible, of the Obamacare. The Republicans, of course, want to repeal Obamacare. They're working for that because it's a flawed package. I mean, it's better than what came previously, but it's very flawed. And so it is actually indefensible. The Democratic Party is focusing on defending the indefensible rather than focusing on Medicare for all, which is the very best health coverage that we can possibly come up with. And so, Obamacare without a public option, it's been flawed, forcing individuals to purchase inadequate policies from private health insurance companies who benefited from that by forcing high premiums, high deductibles, high copays, and then also forcing narrow networks. And so it's just not a great package to defend. And so that's a waste of time. With all the time that's been left open by not defending Obamacare, that time can be filled with lobbying for Medicare for all. People try to make it hard, but it's easy. All that needs to be done is to drop the mandate for 65 years and older, and then everyone is covered. It happened in Libby, Montana. It's happening already in Washington, D.C. with government workers. And so it can be done. It's not hard, it's easy. It's just, do we have the kind of people in office that will actually make an effort to do that? And so some of the Democratic Party has said, well, it's just not doable because the insurance companies are so powerful. Quite a few of them actually get high campaign donations from the health insurance companies because the health insurance companies do not want Medicare for all. They want the high premiums and deductibles and co-pays. That benefits them. It does not benefit anyone else. Anyway, as of December 2015, a national Kaiser public opinion poll found that 58% of adults in the United States support single payer Medicare for all, including 81% of Democrats and 60% of independents and 30% of Republicans, which is the majority. And so when Medicare for all is fully explained and people understand what it is, how simple it is, how comprehensive it is, the benefits of it, there's likely to be an increase in support rather than people saying it cannot be done. There needs to be a fire lit under certain members of our Congress to actually work and make an effort to try. So far, Nancy Pelosi has done nothing. She's just said, nah, I'm going to just enjoy my health care and watch all of you scream for help. It seems like that's what she's doing. So Ralph Nader's not having that, and I'm hoping that John Conyers is not having that, and I'm also hoping that the North American public has come to the point where they don't want to have that either. The packages that have been put forth by certain members of the Republican Party so far are just not, it's like you repealed Obamacare for this. The only thing that's actually better than Obamacare is Medicare for all. Everything else is a step backwards. And as I've outlined in certain regions of the United States, Libya, Montana, for instance, Kentucky, where there's the highest cancer rate in the nation, and then Utah, where there's also people trying to legalize medical marijuana because they cannot afford the high cost of prescription drugs. People are searching for better health care than they have previously. They need coverage. And so hopefully when John Conyers introduces his bill, everyone will be watching to see who is voting for the people and their health, and then who is voting against them in anticipation of 2018 elections. Everyone should be watching. Good luck.